Well, good morning, everyone. I'm very happy to be here at our Tinley Park Convention Center mass vaccination site as we launch the newest phase of our state's vaccination administration plan for those 65 and over and for frontline essential workers. Thanks to the Illinois National Guard, the Illinois Department of Public Health, and the Cook County Department of Public Health, this is now the 7th new vaccination site that we've set up across Cook County, with similar efforts ramping up in regions all across the state, with approximately 25 more National Guard teams set to launch in the next few weeks alone. As more vaccine becomes available from the federal government, additional mass vaccination sites are slated to begin operations, building on existing community vaccination efforts of your local health departments. And hundreds of additional pharmacies are getting ready to offer vaccinations statewide. This Tinley Park location, which will start its appointment-only vaccinations tomorrow at 8:30 a.m., is set to do 9,000 vaccinations per week, with the capacity to administer 18,000 weekly doses when our federal supply increases. And this is just one of many locations that have been launched in partnership with local public health departments or pharmacies. Widespread vaccination sites will allow us to quickly and efficiently get these life-saving doses to Illinoisans as more federal shipments of vaccine come online. I want to recognize Cook County Board President Toni Preckwinkle, Cook County Health CEO Israel Rocha Jr., and Cook County Health COO and Ambulatory Services lead Ileana Mora for making this site possible. And a big thank you to Senator Mike Hastings, who's here to my right, Representative Debbie Myers-Martin, our Cook County commissioners that are here joining us, Major General Richard Neely, the Adjutant General of the Illinois National Guard. I may have forgotten other elected officials. I hope I haven't, but I want to make sure that they're all recognized. A special thanks to Dr. Whitney Lynn, a family medicine physician here in Cook County, for coming, because she's going to share her vaccine experience with all of you. Appointments to be vaccinated at this location will launch at noon today, and President Preckwinkle will offer more details about how Cook County residents can access the appointment process in just a moment. And all Illinoisans, whether you live here in the south suburbs, in Rockford, the Quad Cities, East St. Louis, Cairo, or anywhere in between, can find what vaccination locations are available near them by going online to coronavirus.illinois.gov. Our statewide vaccine locator on that website is searchable by both zip code and city. You'll also find a guide to who qualifies for vaccines in this new Phase 1B. Broadly, it includes those 65 and over and those classified by the CDC as frontline essential workers, such as teachers, first responders, and grocery workers. This website also directs people to the COVID-19 vaccine registration or appointment booking homepages of county public health departments, as well as for our pharmacy partners like Walgreens. Already, Walgreens and Jewel Osco are adding appointments at hundreds of locations statewide, and CVS, Hy-Vee, Mariano's, and Kroger will soon follow. Hundreds more locations will be added as more vaccine is shipped by the federal government from vaccine manufacturers. Nearly 750,000 doses of vaccine have been administered in Illinois already. And the rollout of Phase 1B is truly an exciting development. But I want to remind everyone that there are only about 120,000 first doses arriving in Illinois, outside of Chicago that is, this week. Because of the federal supply limitations, I want to emphasize that vaccinations are being given by appointment only. I've said that before, but I want to make it clear so people don't go line up at their local pharmacy or line up at their local health department. We need you to make sure and make an appointment for your vaccination. And that'll be the case, by the way, for the vast majority of people. That is, that you may be unable to make an appointment immediately. But just know that you can check back at coronavirus.illinois.gov or directly with your area pharmacy or your local health department to see when vaccines are becoming available. More appointment times will be added each week as more federal vaccine supply is shipped. Every state in the nation is experiencing this same shortage. It's another example of the Trump administration's tragic incompetence that they didn't invoke the Defense Production Act and didn't order more vaccine from the manufacturers. Well, we have a new president now, and he's already taken steps to expand vaccine manufacturing, and in the meantime, Illinois has taken the steps necessary to be ready, with sites like here in Tinley Park, to vaccinate as soon as those expanded shipments arrive. Still, for the time being, please everyone, mask up, keep your distance, wash your hands, and remember, we'll stay healthy and safe if we look out for one another. So thank you, and I want to now introduce someone who's been working hard every day to keep the people of Cook County safe and healthy, and that's Cook County Board President Toni Preckwinkle. Toni?
Thank you. Thank you. Good morning. I want to thank you, Governor Prtizker. We're deeply grateful for the help and support that we've gotten from the state, and particularly today the National Guard, who are helping us stand up this vaccination site. It's an honor to be here, and before we start, I want to acknowledge our other speakers and elected officials who are present, in addition to Governor Prtizker, of course, Commissioner Deere, who is head of our Health Committee in the Board of Commissioners, Commissioner Morrison and Commissioner Miller, who represent this area, Commissioner Anaya, Commissioner Lowry. I also want to acknowledge Clerk Karen Yarborough, Public Defender Amy Campanelli, Commissioner Michael Cabinargi from the Board of Review. We're grateful that you joined us, all of you. I want to acknowledge Israel Rocha and Ileana Mora from the Cook County Department of Public Health. Israel Rocha is our CEO. We're grateful that he came to us from New York. Tinley Park Mayor Jacob Vanderberg, thank you for joining us. I'd also like to acknowledge Illinois State Senator Mike Hastings, Illinois Representative Debbie Myers-Martin, our National Guard representative, Adjutant General Rich Neely, Dr. Whitney Lynn, who's going to be speaking later about the shots that she received, Bill Barnes, who's Executive Director of EMRS, and his deputy, Ted, Dr. Kiran Joshi and Dr. Rachel Rubin, who are the co-leads of the Cook County Department of Public Health, and Cook County Health Board member Mary Guggenheim. Thank you all for joining us. I also want to acknowledge Mark Mokita and Lainey Kleeman, who are our sign language interpreters. Again, I want to thank everyone for being here and to support our efforts to move beyond this challenging period in our history as a county and as a nation and begin to heal our communities. We're gathered here to celebrate a major development in our COVID-19 vaccination efforts. As we continue Phase 1A vaccinations and begin Phase 1B, I'm proud to be standing here with Governor Prtizker and my colleagues to announce that the Tinley Park Convention Center will serve as Cook County's first large-scale vaccination site. This is the first of several that will be opening soon. Opening tomorrow, this site represents one of at least 5 larger vaccination sites that will be opening across suburban Cook County in the coming days and weeks. Additionally, today at noon, we will officially launch the county's vaccination sign-up webpage for residents who live or work in Cook County. Individuals included in Phase 1B That's residents 65 and older, essential frontline workers, such as first responders, our police and firefighters, EMT folks, manufacturing employees, grocery store personnel, pharmacy personnel, and others will now be able to go to our website, vaccine.cookcountyil.gov. I'm going to say that again, vaccine.cookcountyil.gov, to learn more about the vaccine, check for updates, and set an appointment to get vaccinated when the vaccine is available. Again, one more time, vaccine.cookcountyil.gov. For those of us who are not technologically savvy, I include myself in that category, we also have established a hotline for anyone in 1B looking to schedule a vaccine appointment. The call center will go live today at noon as well, and the number is 833-308-1988. 833-308-1988. It's available Monday through Friday, 7 a.m. to 7 p.m. And while we're excited to be taking these steps, I want to make sure that we set clear expectations. At this moment, not just here but across the country, demand is heavily outweighing our supply of vaccines. One more time. Demand is heavily outweighing our supply of the vaccines. By our estimates, over 600,000 suburban individuals are eligible for vaccination in Phase 1B, 600,000 people. However, we do not have adequate vaccine supply to vaccinate everyone immediately. So with this in mind, we're once again asking for your patience. While current supply does not now meet demand, we're standing up large-scale sites like this one to ensure that we're ready as vaccine continues to be distributed in Cook County. In partnership with the state of Illinois, we stand ready to contribute to the Biden administration's goal of vaccinating 100 million people in the first 100 days. Today is a hopeful day for our county and our state, but today also represents something personal for me. As a black woman and as the mother of a nurse, I can tell you firsthand that our communities are ready for the next chapter. Last year when the pandemic began, the Cook County Medical Examiner's Office and Cook County Health worked to establish a protocol and build capacity for what we knew would be a surge in deaths. Don't get me wrong, we're still losing lives every day. More than 400,000 Americans have succumbed to the disease. But now, a year later, I'm so grateful to be here planning for a surge in residents getting the vaccine. Today, that sliver of light at the end of the tunnel is just a bit brighter. Now I'd like to welcome to the podium Israel Rocha. I'm very grateful to him for coming to head our healthcare system in this tumultuous time. I tease him all the time about not wanting to go back to New York. So I am very grateful to introduce Israel Rocha. Thank you.
Good morning, everyone, and thank you. Thank you, Governor Prtizker and President Preckwinkle, for your steadfast support on our efforts to vaccinate as many Cook County residents as possible. This is an exciting day as we stand up the first of our multiple large sites across Cook County in the coming weeks and months. We are committed to a program grounded in equitable distribution of the vaccine to ensure that our most vulnerable and the areas most impacted by COVID have access to the vaccine. I know that folks are tiring of this message, but it is important that we echo both what the governor and the president said. Vaccine supply is extremely limited. However, we will work with you to make sure that we have the vaccine available and that we will be able to meet the needs of everyone to get vaccinated. We fully expect that all available Cook County Health appointment slots available this week will be booked, and at least the first day, and on the opening of our microsite and our call center today at noon. And we know that this will be disappointing and frustrating. Please know that everyone shares that sentiment, but we will work with you. It will something that is not going to be done in the first few hours or the first few days, but it will take weeks, and we are here to make sure that we're here through the duration, that every single individual who wants a vaccine can get a vaccine. And we are committed to being your partner in that effort. If ever there was a phrase, this is a marathon and not a sprint, that is today. We are anxious to vaccinate all the people that are able to receive the shot, but patience is needed as the federal government works up to ramp up production. It is also important for people in 1B to understand that in addition to our CCH clinics and sites like this one today, Cook County Department of Public Health has partnered with and distributed vaccine to more than 90 other locations throughout suburban Cook County. These will include places like Walgreens, Julasco, Mariano's, as well as other hospitals and federally qualified health centers. Individuals in 1B who have signed up with us will have detailed information to make sure that they can get to those locations. When you visit our new microsite that will launch today at noon, which is vaccinatecookcountyil.gov, it is critical for people to remember that all sites share appointments at this one time. So sort of to go over that just again, because it's the most important thing that I'm here to talk to you about today, is when you go to the website, whether you are in 1B or not, you can register. You can get information. That will take your information to make sure that as you become eligible, as you work through the website, it will tell you whether or not you are eligible to be able to make an appointment today. If you are not in the category given by the information you have supplied in 1A or 1B, you will also have your information and you will continue to get updates about the vaccine, about its supplies, about its location. If you are able or meet the parameters based on the information provided to qualify as 1B, you will then have an opportunity to schedule. In order to make sure that we don't have people interrupting their days when there is not a guarantee of an appointment, the website will only reflect appointments which vaccine is guaranteed. So we know there have been in other jurisdictions discussions about how vaccine appointments have been canceled. We're trying to avoid that. Our process will only post the availability of appointments where a vaccine is guaranteed. And as you've heard, the governor and the president are working diligently to make sure that they work with the Biden administration to bring in an additional influx of vaccine. That is important, as sometimes people will get frustrated. They will not see enough appointments. They will wonder if more are coming. We promise that we will do everything to make sure that more are on their way. The appointments will be scheduled on the amount of vaccine that we have so that individuals will have that guarantee of appointment. That is why it's important that people also recognize that all the sites work on an appointment system. And so you do need to go through the appointment system, have your guarantee of appointment to make sure that everyone who has an appointment can get their vaccine and we don't create any issues or concerns with not enough supply. Our problem is to make sure that everyone gets through as quickly and as equitably and as fast as we can, but as appropriate as we can. So we're asking for your partnership in this endeavor. It's together that we will be able to finally put COVID to bed. This is a huge start in that process. And as we prepare for the opening of this site tomorrow, I want to thank all the county departments, the staff members, the state, the military, and everyone who has made this possible. The Illinois National Guard, the governor's office, and everybody who has stretched across to make a fantastic network of healing for the state of Illinois. Standing up this facility of this size requires so many different people working together to ensure that we have the wiring and equipment needed for technology, the supplies, the staffing, the refrigeration, the patient and traffic flow logistics, the security, and even the funds to make sure that we are here to operate today. We have had doctors, nurses, pharmacists, IT, public health professionals, lawyers, our partners at the National Guard, our project managers, operational leaders, civic and public leaders, and dozens of others who have helped make this a fantastic program and the start to the end of COVID-19. We thank everyone for their endeavors to make this possible. It is definitely a village of individuals who have healing on their minds who make this possible. And again, just to review, the microsite is vaccine, vaccine.cookcountyil.org. And to remind of the hotline, it's 1-833-308-1988, and the hours of operation are Monday through Friday, 7 to 7, but it will kick off today at noon. We are so excited to be your partner. Cook County Health is excited to be here to make this day a historic day for the state of Illinois. And again, we thank Governor Prtizker and President Preckwinkle for their leadership in making this possible. And it's my pleasure now to bring forward the chair of our Health and Hospitals Committee for Cook County, Commissioner Dennis Deere. Thank you.
Good morning. I am happy to be here this morning. How many people happy this morning? All right, woohoo! Yeah, let's brighten it up in here a little bit. Listen, I have 2 points I want to make. But before I do that, I want to say thank you to all of my colleagues, all of the elected officials, to the governor, to President Preckwinkle, to our brand new CEO of Cook County Hospital, who is all the way from New York, who has hit the ground running. I know that the president has talked to him several times, probably a day. I get to say that I talk to him at 1 in the morning, right? Because that's how hard this guy's working. So we're thankful to have him. I got 2 points I want to make. Socrates said a long time ago, if you always do what you've always done, you're going to always get what you've always got. The 2 points are, every single person has to get vaccinated. I've talked to people in my community, and they have said, well, I don't want to get vaccinated because that's the Tuskegee experiment. Well, listen, this is not that, all right? This is not that. And so we want you to get vaccinated, right? Now, the second point is that we all have to realize that the African American community and the Latino community has been hit hardest by this virus. Over 400,000 deaths across this country. 25 million people across the country have contracted COVID. That's a lot of people. So guess what? Although we want everybody to get vaccinated, we want you to get vaccinated using something that my mom would often tell me to use. She said, son, in all things, have patience. She told me that patience was a virtue. And so as we are unrolling and unveiling this mass vaccination site, and those who are in the subcategory to get their vaccination, please have patience. Everyone won't be able to get vaccinated at the same time, but one thing we can assure you that will happen. If you want to get vaccinated, you will get vaccinated. Just be patient. I will be brief, and I will end with this. I started with Socrates. I want to end with a deerism. That means I made it up, right? In order for you to get something that you never had, you got to do something that you never done. Get vaccinated. God bless you.
Good afternoon, everyone. I'm Cook County Commissioner Donna Miller. I represent the Southland, so I'm happy to be here. And we are definitely on the road to recovery, which is a great step for us all to feel and experience today. Thank you to the Governor and Illinois Department of Public Health, along with President Preckwinkle and Cook County Department of Public Health, to work diligently together to make sure that all of us do get vaccinated, but we're following the new plan from the Biden-Harris administration that we will be on the road to recovery soon. As we know, the African American and Hispanic communities have been hit hardest. I represent the Southland, where we have had the vast majority of deaths in Black and brown communities. We need to get past the vaccination hesitancy that people experience and make sure that we do sign up to get vaccinated, help our seniors get on the 1B registration if they don't have access to computers. We need to make sure that we are also educating our frontline essential workers that this is the time for them to come and get the vaccination as well. So we look forward to the next steps and moving not only our country, our state, our county forward, but also getting back to business, getting our kids back in school, making sure that we're able to have all these people gather safely, and in the future that we all make sure that coronavirus will be something we can manage in an effective way. So I appreciate you all being here. I look forward to what happens out here, not only just in the Southland, but across Cook County and the state of Illinois. And with that, I'd like to introduce my colleague, Cook County Commissioner Sean Morrison.
Thank you all, and good morning. A lot of great information has been provided, and hopefully we can get that out to the general public. A few things I would say. Today's a day of hope. Today is a day of hope. Today starts the return to normalcy. Today starts to offer protection for those 65 and older and those with other health ailments. That's the start to getting us back. That's the start to getting all of our children back in school. That's the start to getting people back to work and getting employment and jobs back going again in our state and our country. So really today is a day of hope, and that's the message I want to bring. I want to thank the governor. I want to thank Board President Preckwinkle. I want to thank our National Guard and all of our first responders that have been out there that are getting us going. But that's the message to deliver. And I want to opine on one more thing. Some of our folks are not going to be technical savvy. So let's really, the younger folks out there, make sure that you go to your grandparents, your parents, and if they don't know how to get signed up, help them sign on. Help them make those phone calls into the call center number. That's also an important piece of information that we need to get out there. Thank you all very much. It's a good day for Illinois and a good day for Cook County and a good day for our nation. And with that, Rep. Myers-Martin.
Good morning, everyone. Good morning. Good morning to Governor Prtizker and President Preckwinkle and all of my local, county, state elected officials. I'm so happy to be here. I am State Representative Debbie Myers-Martin, and the Tinley Park Convention Center is in my district, as well as Senator Hastings. So this is a very exciting morning for me and for all of us. For nearly 10 months, Governor Prtizker wasted no time in putting our state on notice after the discovery of the first case, community spread of COVID-19 in Illinois. Since then, the pandemic has seemed to drag on for an eternity. We are fast approaching 1.2 million total cases in Illinois, and we have seen our economy and our daily lives change rapidly. And we have lost far too many lives and livelihoods. But thankfully, we now have a way out of this nightmare. Thanks to our hardworking scientists and medical professions, we have multiple viable vaccines that are being distributed across the country. But here in Illinois, we are grateful to Governor Prtizker and the Illinois and Cook County Departments of Health and the team of talented health professionals that the vaccine has become increasingly available throughout our state. We know vaccinations are the quickest, most effective way to achieve herd immunity, and we have in our nation's history defeated and managed other diseases such as polio, shingles, and yes, even the flu with vaccines. We will defeat COVID-19 the same way. Unfortunately, despite these proven successes, we are seeing some level of apprehension to receive the vaccine. While it is easy to understand this hesitation in some communities, many have questioned the rapid development of the vaccines. However, while the vaccine was developed in record time, it also has been tested on all types of people, including people of color. So to the many people who have reached out to my office about the availability of the vaccine, I am excited to exclaim that thanks to the collaboration between the state of Illinois, Cook County Department of Health, and the village of Tinley Park, we now have the opportunity to receive the vaccine here in our South Suburban community. I am looking forward to the possibility of going back to church and sending our kids back to school. Nearly 1 year into this pandemic, the end is finally in sight. Each vaccination is a step towards normal. So I want to thank the governor, Cook County Department of Health, Illinois Department of Health, President Preckwinkle, and all of the people that made this possible for us now to have that urgent vaccine here in the Southland region. So thank you so much, and with that, I will introduce Dr. Whitney Ryan.
Good morning, everyone. Good morning. My name is Dr. Whitney Lynn. I am a family medicine physician at the Cook County Health. I want to thank Governor Prtizker, President Preckwinkle, and Mr. Rocha for inviting me here today to speak about the importance of being vaccinated and for your commitment to ensuring that everyone who wants a vaccine will be able to get one. Today serves as a milestone for the state and the county as we open this community vaccination center and move on into phase 1B of COVID-19 vaccinations. which will include residents over 65 and our frontline essential workers. The COVID pandemic has taken too many of our friends, our colleagues, family members, and loved ones. By now, we all know someone who has suffered from the virus or has succumbed to it. My colleagues and I at Cook County Health are committed to getting the vaccine into the arms of all the residents of the county, especially those most underserved and vulnerable. I have received both vaccines, and I want people to know the vaccine is safe and effective. I have encouraged everyone who is eligible to receive it. As a reminder, researchers from around the world have worked incredibly hard on the development of this vaccine, which builds off decades of research into vaccinations. Nothing has been rushed. The vaccine is safe and effective and our best tool to fight against COVID-19. The efficacy demonstrated by this vaccine, over 95% for 2 doses. People who have received both doses are considered to be achieved full protection after 2 weeks from the second one. It is critical that you choose to be vaccinated, both doses on the recommended timeline. The more people who get vaccinated, the more people who are protected from COVID-19. The more people who are protected, the sooner we can resume to a normalcy. Some people who receive the vaccines will experience some minor side effects. You may be a little tired, you may experience muscle aches, but it is also much better than getting COVID-19. Experiencing side effects does not mean that you have COVID-19, but signals that your system is responding to the vaccine. I would like to remind all residents that even after getting vaccinated, you must continue to do what is safe for everyone. We still have to wear our mask, and we still have to physically distance. As soon as everyone is vaccinated, we will get closer to getting back to a normal life. Today is an important step in the right direction. Thank you. Governor Prtizker will come back up for some more questions.
Great, thank you very much, Doctor, and obviously President Preckwinkle here to answer questions as well, but happy to take any questions from members of the media. Hannah. So that's a great question. I think for anybody who didn't hear it, the question was for those who don't have transportation to one of these sites, for example, to the many sites that are opening up, whether it's a Walgreens or a county public health department, how will they get that transportation so that they can get vaccinated? First of all, we at the Illinois Department of Public Health have been working with the 97 local public health departments to provide them any support that they may need. And of course, they often already have plans to deal with the fact that, particularly in rural areas, there are many people who may not have a vehicle but may need a ride. So it's good that we have these local public health departments that know their counties and know all the regions within their counties to help with that. And then finally, I would say it's very important for us to get the word out to everybody across all the rural counties as well as across Cook County that they can get in line now. They can either book an appointment now, or they can sign up to get notified when there is an appointment available, so that the county public health department can then help them get to the site of their vaccination when they need it. Yes, ma'am. Well, let me start with Illinois is 6th in the nation in terms of the number of doses that have been administered. Very proud of that fact. We continue to make sure that we're vaccinating in 1A, which is the original phase here. I also want to point out that one of the, I talked a little bit earlier about the failings of the Trump administration. One of the things that they did was they created this federal pharmacy partnership program with 2 large pharmacy companies to do all the vaccinating at our nursing homes, at our various assisted living facilities. We have about 1,700 of them across the state of Illinois. And that program has gone exceedingly slow. And the federal government required that the number of vaccines be taken out of our entire allotment. All the vaccinations that are necessary for that entire group have been taken out already of our allotment. And they sit on shelves because that federal pharmacy partnership is so slow at the job. Having said that, I have had numerous conversations. My team is in regular communication with those companies, and they have promised that they will get through the first visits to assisted living facilities by February 15th.
So I just wanted to ask you if you could clarify something for me, because
Sure.
and I don't know if their numbers are up to date, but the New York Times has a chart of how the states are doing.
Yeah.
And it is the New York Times that has Illinois near the bottom of the list. But they've also had saying that Illinois has received about 1.4 million doses of the vaccine, and that only half of them have been administered. Is that the reason why exactly you just said?
Yeah, there are hundreds of thousands of doses that have been removed from our ability to vaccinate others and put aside for people who are in long-term care facilities. So that's hundreds of thousands right there. And then in addition, as I've said for more than a week now, or actually a couple of weeks, there's a time lag between the time that someone gets vaccinated and the time that that gets reported to the CDC, which is then there's a time lag between that and the New York Times or anybody else being able to publish that number. So you immediately get published the number that have been delivered to a state, but there's a time lag in the time between someone is administered a dose of vaccine and at the time that that gets reported.
So to be clear though, you're looking at numbers from a basis of a percentage of our population. Illinois has 13 million people, Idaho has not that many. So that's not the best metric.
Yeah, I think one of the things, and I do this on a number of other metrics as well, you know, it's as you can imagine in a state like West Virginia, there are many, many, many fewer long-term care facilities, for example. And so the idea that the 1,700 here are equivalent somehow to the, I don't know, very few in West Virginia isn't taken into account in any listing by the New York Times or anybody else. They're just taking it by, you know, they don't even consider the size of the state.
Now, let me ask you about phase 1B, the challenges that, and you, I mean, everybody here has mentioned that in terms of patients, and it'll take some time, but for example, there's several of the collar counties that have said they're not even in a position to begin with phase 1B for another week or two, because they're still making their way to 1A. Or in Lake County's case, saying that they don't even have enough partners signed up to administer the vaccine. How is the state looking to assist these individual counties that are having challenges getting to that phase?
We're partnered with every single county. They have the ability to work with our Illinois Department of Public Health to improve their capabilities. We have an interesting system here in the state of Illinois with these 97 local public health departments. That's been the case since long before I became governor, and they are independent. They're independently appointed by and run by county governments across the state. Different county governments have different capabilities, have different dollars available to run their county public health departments. And as you probably know, before this pandemic, many of those local departments were never expecting anything like a pandemic, couldn't possibly deal with it as it came on. And we've been very strongly partnered with those smaller local public health departments. As to the collar county departments, they reach out to us whenever they need help. The biggest challenge that they have right now is vaccine supply. It's not that they are sitting on, as you will hear, in fact, I think I just read in one of the local newspapers today, some were saying, you know, if we only had more vaccine, we would be pushing it out more. We have the capability to do that. Please send us more vaccines. Frankly, that's exactly what I would like to do.
Is lack of resources also an issue, just in the sense of the money that you need in order to deal with all of these resistance?
The federal government in the CARES Act provided dollars for vaccinations, and so that's not the biggest challenge that we have. The biggest challenge, honestly, is without more vaccines coming in, you don't want to set up sites and have them sit idle when you only have 120,000 new doses coming in for first doses per week. Think about that, and think about the fact that at peak, this facility could vaccinate 18,000 people per week, and this is just one site. So you don't want to, overbuild, but you want to be ready with the infrastructure when the vaccines and the number of doses increase.
Governor, have you spoken
Yeah.
to the Biden administration about when we can expect an increase in the distribution of the vaccine?
Yes, I'm glad you asked that. So to those who didn't hear the question, have I spoken with the Biden administration about when we might see an increase in the number of vaccines? Yes, I've had numerous conversations with leading members of the Biden administration. My team, both in the governor's office and the Department of Public Health, is regularly talking to the new appointees in the new administration. By the way, I think you all read that there was no plan left behind for them. Many of them, I spoke with one person this morning who said that when she came into the office just the day after inauguration, they had nothing. They were given no information. The people who had been there before left them with nothing to work with. So they've had to pick up the pieces from that. Having said that, President Biden did two very important things immediately. One is he authorized 100,000 new public health workers to work all across the United States. We haven't had any of that help from the prior administration, rather. So that's one very important thing. A second, of course, is the Defense Production Act, which I've been calling for since the very beginning of this pandemic. It should have been authorized at the beginning for PPE when we knew that we had vaccines in development and possibly ready for approval. It should have been invoked. Instead, what's happened is that the companies that are producing vaccine are selling the amounts that were contracted by the federal government to the federal government, which is distributing to us. The remainder being sold all over the world and outside the United States. We need to make sure that we're getting enough so that we can vaccinate everyone in the United States. And then, and the Defense Production Act will allow us to do that.
Give me an indication of when that might come, that you might start seeing a boost in the numbers.
So it's hard for them to estimate. So they have not told us exactly when that will be. But suffice to say that the Defense Production Act allows you to free up all of the ingredients, all of the supply chain that are involved in the creation of vaccines, and allows the two companies, Moderna and Pfizer, to ramp up production in a more substantial way.
There is that, however, that until the J&J vaccine is authorized, maybe
I wouldn't say that. I want to express some optimism here because I really do believe, based on what I've heard, that we don't, that we all want the J&J vaccine to be effective and authorized. I don't know when that'll happen. Nobody's promised that. That's something you couldn't know without the scientists ruling on that. But prior to that, I do believe that these actions, in particular the invocation of the Defense Production Act, will allow us to increase production in the United States, and therefore for Illinois, which gets its fair share. We get the percentage of our population in Illinois. That's the percentage of the vaccines that are available to the entire country that come to us. It's a little less than 4%, I think, of the entire amount that is being produced. So we look forward to continuing to ramp up the first doses. And remember, we've also delivered, and this is very important, 100% of the second doses to people. And that's a very important, getting almost 100% of everybody to show back up again 3 or 4 weeks later for that second dose to make sure that they're fully vaccinated. Very, very important, and that's happened.
Among the group of 1B eligible people, are we prioritizing people within that people with comorbidities that are 65 and older?
So the challenge with, I want to be clear, right? The challenge with 1A has been that that because of the limitations of 1A, the numbers of people in 1A, that made it more challenging actually to get the vaccine doses into people's arms. because just you've got, pockets of people that aren't as easily accessible. They may take more time to actually get accessed, and you've seen this federal pharmacy partnership, slower than anybody expected. So I think our expectation is that because we opened up 1B, there won't be any doses that will sit for a day or two or three, that in fact people will come here, we'll be allocating vaccine to all of the locations where we know we can run lots of people through, and we believe we'll be able to vaccinate many, many more, greater percentage at a time. Yes. Yeah.
So you're asking people that are in phase 1B to be patient, and so could you just further explain what will happen if they go to your website, but then they're not able to get an appointment? What happens for them? Are they on a waiting list, or how does that work?
Sure. So every time someone comes to the site, they're going to enter their information. That's going to put you on a listserv that we will give you updates. We're also going to ask if you want us to give you updates, additional updates, just about the vaccine, its availability, information. So once you're on there, whether you're eligible or not, you're in queue, and we have the information. So if at any point we don't have appointments available for you, and you need to make sure that that you get availability, we will email you every single time new appointments are added to the website. So the website will only have, again, appointments for which we have vaccine, and we can guarantee if for some reason there's no appointments available, you are entered in queue. Every time we update the site with availability of appointments, you will get notifications based on that information, and if you're eligible at the time. So if you're at 1A, 1B, 1C, it will continue to update. So if you went today and you registered and you were 1C, your information would say, we've now gotten your information. As soon as 1C became available, you would get an email saying you now are eligible, you can come back and you can schedule. And so that's the information and how it would work. So we encourage everyone again to be patient. You will be notified every single time that you are eligible and we have appointments available. You will get that information.